I'm Teresa. I'm one of the lead officers for the Health Sciences Outreach team at Leeds University. So I'm going to talk to you today about a career in health. You've seen lots of wonderful presentations already about all different aspects of healthcare and medicine and dentistry. So I'm really here to provide you with an overview of things at Leeds. So I'll be talking about our courses obviously at Leeds and a little bit about applying to Leeds and what that means. I'll be highlighting some notable dates and then leaving plenty of time for questions and answers. So why might you be interested in studying a career in health? You can see my notes here, so I can't seem to do much about that at the moment, but bear with me. As far as I'm concerned, there are so many different specialities within health and medicine and dentistry that you are spoiled for choice. So if health is an area that is of particular interest to you, you can't go far wrong. There will be something there to suit everybody. Career security, well, human beings have a habit of getting ill, getting old, getting sick, and we're fairly accident prone as a race. So health and medical professionals will always be needed. You never stop learning. You learn at school to progress to university, you learn at university, but it doesn't stop when you get your job. You will be learning alongside other professionals. You may get involved in research, cutting edge research to look for a vaccine, for example, but you might be doing CPD to move into a more specialist area. So you never ever stop learning. And that collaboration is key. You never stop working with other people, and they're not just people who are doing the same job as you. There'll be sometimes potentially even hundreds of different people working in a busy hospital or different disciplines, different professions. And fundamentally, I'm guessing that for a lot of you, the most important thing about health and medicine is that you're making a difference and having that all-important impact on somebody's life. So, as it says here, we've covered some of the pros of a health career, but it is actually really important for you to think about the cons, think about the downside of the profession. This is really so that you know what you're letting yourself in for. So there will be days when you will be coping with quite high stress environments. They could be emotionally charged, difficult and challenging circumstances. It is time pressured. You'll be dealing with loss at some point, and you'll be dealing with difficult patients, sometimes patients who don't want to be there, or family members who are also distressed because their family member is ill. It can take a very, very long time to train. Now, for some health careers, it can be 3 years in uni and you pretty much start as soon as you leave. But for others, you're looking at 7 to 10 years. So the examples I've given there are doctors and psychologists. It can take a good 10 years to get to where you think you want to be. There are long hours as well. While there are some roles which are more traditionally 9 to 5, and they do exist, most are long hours, possibly about 12. It's shift work, and that means working weekends and bank holidays. You have multiple responsibilities. So many professionals are responsible for not just their own workload, their own caseload, but their own admin as well. But they may also be responsible for a team of staff. And something which, of course, unfortunately is very sort of topical at the moment is your increased exposure to germs. So this is courses at Leeds and all of the different courses that we study here in the Faculty of Medicine and Health. So as you can see, we've got the School of Dentistry, School of Healthcare, School of Medicine, and the School of Psychology. Now, what I'm going to take you through is just a brief, quick overview of all of the courses that we do here at Leeds, so enable you to sort of think about whether Leeds is something that you want to delve into in greater depth. And of course, we're going to have time for questions at the end. So starting with dental surgery and oral science, this is the only joint integrated course in the UK. And what that means is that you come out of it with not just your bachelor degree, but you also come out of it with master's level degree qualification as well. At Leeds, we pride ourselves on early clinical exposure, and that's in a range of settings throughout the course. We have excellent teaching clinical facilities. As you can see in the picture there, we also have full Simodont labs, which I don't know if you've had the opportunity to have a play with anything like that. It's quite good fun, sort of 3D goggles, and then you use the 3D software to actually sort of drill into teeth or whatever other thing, and the software mimics the exact sort of resistance that you would feel if you were actually really drilling into a tooth. And at Leeds, the whole dental team is actually trained together. So that's not just the dentists and the hygienists and therapists that we train at Leeds, but it's also those students who are studying through the NHS, the dental nurses and the dental technologists. I'm just going to briefly go over this, just sort of highlighting anything that's different or that stands out, because you can get all of this information on the web, and it's not very interesting for you guys if I just sit here and read this out. But key things to note with dentistry, as I'm sure many of you are aware, is that BTECs are not generally accepted, and dual science is accepted at GCSE. So over to the School of Healthcare. Excuse me. One thing that we do at Leeds is we teach all of our healthcare students together for the first year. So while you might have 1 or 2 modules or a few sessions that are unique to your course, the majority of the time you'll be learning alongside other healthcare, future healthcare professionals. The Kevin Kendrick's Clinical Skills Suite does recreate a hospital ward. We've got a few different rooms for different specialities and the appropriate patient mannequins, along with SimMan and an ICU, all of the sort of associated ancillary equipment you'd expect to see in a working hospital, and washing areas. The courses are all 50-50 theory and practice. Depending on the course, you'll do a bit in first year, a little bit more in second year, and a lot more in third year. But generally, with nursing, adult and child nursing, it's 50-50 all the way through. What we are looking for in our future nurses from Leeds is that they become sort of like the leaders of tomorrow, and you develop your problem-solving, decision-making skills, and you're an innovator and advocate for your patients. And again, you can see the entry criteria there at the bottom. The thing to point out with Leeds and entry criteria, particularly for anybody studying BTECs, is that you must list all your modules on your UCAS form. They're quite science-focused degrees, and therefore if you haven't done enough science in your BTECs, you might find that at least in the first year that you do tend to struggle a little bit. So they are looking for science modules within BTEC. Again, with mental health nurses, join in on that first interdisciplinary year. Students also have access in the same area where the clinical skills suite is. There's a simulated community flat. So that's to give the students a sort of idea of how it might be actually trying to perform certain skills or hold conversations with people in a home environment. So it's quite different from the hospital simulated hospital wards that we have. The key thing to remember with mental health nursing as well is that the focus is actually on that therapeutic relationship that you have with your patients, rather than the sort of clinical skills side with the other courses. Less of an emphasis on science with mental health nursing. Midwifery. Again, one of those rooms in the clinical skills suite that I mentioned just a moment ago is actually kitted out just for midwives. We integrate research-led teaching throughout the whole university, but again, particularly in midwifery. UK is sort of, well, it used to be quite unique in that it was midwifery-led care. So those of you familiar with how people have their babies and the care that is provided to them in somewhere like the United States, for example, it's very, very different. You're under a doctor and you go and see your doctor. Obs and gynae, but over here it is all led by the midwife. So generally the massive difference between midwives and some other healthcare professionals is that the vast majority of patients are actually healthy. They're healthy women. and you want them to stay that way. In year 2, you include the high dependency wards in your placements, and in year 3, you actually, as a student midwife, have your own small caseload of women. Social work, also sort of 50-50, but this is one where your theory builds up as you move through the course. So you are learning to become an advocate and support for families and individuals through very difficult times. You develop skills, obviously, to maintain professional relationships, and you have to make some pretty tough decisions, many of which are not necessarily going to go down well with the people who you are trying to help. Placements in each year, 20 days in the first year, 17 the second, and that you will see more than the School of Voluntary Organisation actually move into the independent sector. But the third year is where you go into statutory, so that's where you come up against the child protection issues. I'm just going to pause here because what I meant to do at the start and I hadn't, is if you want to put in the chat what you're actually hoping to do and what kind of subjects and things that you're thinking about at the moment, that would be really great, because then I can see what stuff. I see there's some tips here about the notes. I'm not great at multitasking, but I really appreciate the tips. Thank you. Right, that's fantastic. So I can see that there are some people out there. That's great. I expected we'd see quite a lot of people who want to study medicine. Fantastic. Thank you for that. That's great. So the MBCHB at Leeds, a strong emphasis on communication skills here. It is a very academic course, as you would expect. It is an academic course at all medical schools throughout the UK. We do think that this programme at Leeds, though, has more emphasis on communication skills and working with other partners. We are very involved with the patient and carer community. We have placements now out in the community. So the placements are not all in medical settings. They're not all in hospitals. They're not all in specialist centres. We do have community placements as well. And being an advocate for your community as well as for your patients is something that's quite key. We're the first medical school in the UK with ultrasound teaching and clinical skills fully integrated throughout all 5 years of the MBCHB. We do also have full body dissection, so we have a wet anatomy room, which is something that appeals to some people, not so much to others. I believe that some medical schools do most of their dissection in virtual environment, but yeah, I've been told that you get used to the smell of formaldehyde after a while, but it does make you hungry, apparently. I think the cursor's on the wrong thing. So I'll pause us again here. This is the gateway to medicine. So I'm going to spend just a couple of minutes talking about this programme because this is brand new at Leeds. It's a widening participation and access route, and basically a foundation year. So it turns your 5-year course into a 6-year course. The emphasis on that foundation year is to build effective study strategies and confidence. So to sort of get you up to speed, basically. It uses the same criteria as Access to Leeds, which is our flagship widening participation alternative entry programme. It's not the same, so it doesn't, if you want to apply to the MBCHB under Access to Leeds, you do that route, or you can do this route, and I will look at the entry criteria with you in a moment because it is quite different. It allows progression to the MBCHB, but it is not a standalone qualification. So if you were to come to Leeds to do the gateway year, you wouldn't come out of it with a certificate at the end of it. There are 1 or 2 places that do offer a certificate after that year, and you may get credits, but it is a progression year. The idea is that you progress on to the MBCHB. It has the benefit of being taught alongside the same students, the medical students, and being taught in the same school. So it's aimed, as I said, it's widening participation. You have to fulfil the criteria, which is the same as access to Leeds, and I can provide the link to that at the end of the talk. Eligible students are predicted BCC. The 6 GCSEs are the same. The scoring will be subtly different from the MBCHB, but you do still need to take Bmat as well. Any students who are predicted higher than that, whether that's ABB or even BBB, should apply to the MBCHB through access to Leeds. So, moving still in the School of Medicine, there are 3 other courses I'm just going to quickly go over. There's a question here about the Bmat threshold. That's a question that comes up time and again. Now, the way it works at Leeds is everybody is ranked. So in any given year, it kind of depends on how everybody else has done. We don't have a minimum threshold. We don't have a maximum. We basically just take the top portion of students. So in one year, it might be everyone that's got above 65, and in another year, it might be everybody above 60. So it would be dealt with in exactly the same way, except we take far less students. So in the MBCHB, we would be interviewing 1,000 students based on that ranking process. So we take your scores from your GCSEs, which is quite heavily weighted at Leeds, your your A-level qualifications, predicted grades. We score those, and then we will look at your score that you get in your Bmat and then rank that. And then as a whole, because we're also looking at your personal statement, which is, although it isn't scored, we're looking for other things. We're looking for contextual information, etc. We take the whole application, and then we take the top 1,000 of those to interview. We're not going to be interviewing 1,000 for the Gateway to Medicine. There are 25 places on the Gateway to Medicine course. So in that way, it's slightly different, but it will be dealt with in much the same way, if that makes sense. Please come back to that at the end if it doesn't. Okay, so I'll just quickly go through the other courses that we have in School of Medicine, just because some of you, although most of you are interested in medicine and dentistry, some of you might have thought about some of these other things. Diagnostic radiography, predominantly X-rays, but you will learn about a range of different imaging technologies on the course at Leeds. There's digital imaging, magnetic resonance imaging, which is MRI, for any of you out there who've had an MRI. Computed tomography, I haven't got a clue what that is, if I'm honest, and ultrasound. 40% of the course is spent in clinical placements, and at Leeds, it's in the wider Yorkshire and Humber region. You get short placements if you want. Sweden, Denmark, and Malta are the current sort of partnership, but that may change in the future. The other 2 courses we do within the School of Medicine are both healthcare sciences. I don't know how many of you are aware of healthcare sciences, but there are over 30 different specialisms across the UK. Healthcare sciences students all share a similar first year, and then they go on to specialise in whichever sort of branch that they're doing. We do 2 of those at Leeds. Number 1 is audiology. So we are the only audiology course that actually sits inside the medical school, so that has many advantages, working alongside the medical students, access to some of the same facilities. You obviously become a specialist in hearing and associated disorders, and we have the state-of-the-art laboratories. Placements actually include private sector high street providers as well as large and small hospitals, which is something that is also quite unique. The other one is cardiac physiology. So, using 4D computer technology for enhanced learning. Again, with the patient care community, that is a theme throughout the School of Medicine. Dedicated laboratories and teaching areas, ambulatory monitoring, ECGs, spirometry, and blood pressure monitoring are examples of the clinical skills that you would learn on the cardiac physiology course. This is the School of Psychology building. I'll whiz through this because I'm not sure anyone's thinking currently about doing psychology, but for those of you who might have been thinking about it, we do 4 versions of the same course basically at Leeds. So the standard 3-year BSc, an international option which means study abroad, an industrial option which is a year out on placement, and integrated masters. It's all accredited by the BPS, and again, one of the unique sort of things that we do here at Leeds is we get you to work with research teams quite early on in your degree. So you learn those statistical and analytical skills on the course, and then you can apply them when you work with the teams. And you build up your theoretical knowledge, but you also develop expertise in designing your own research. So, as you know, generally speaking, you have 5 choices, but for medicine dentistry, you only have 4. So your 5th option is really, really important. Now, for a lot of people, they're going to come down on the sort of biosciences side of things. You might want to do an allied health profession, but beware if you're thinking about that, because some places don't like you to choose the 5th option, which is a completely separate profession. An example of this at Leeds would be, don't put adult nursing as a 5th option to medicine, because the adult nurses won't appreciate it. They want someone who's passionate and committed to becoming an adult nurse, not someone who thinks it's like plan B. So it may well be plan B, but you have to sort of think about that 5th option and what it means and what's going to be best for you. Medicine is one of these competitive courses where the higher grades, the better chance you have of getting them. Your personal statement should be reflective, detailing your sort of insight into the profession, your enthusiasm and so on, and how your experiences that you've had so far relate to your course. We do accept the Bmat at Leeds, so some of you will already be registered for the UCAT. If you're having a selection of different institutions, and some do Bmat, some do UCAT, then obviously you need to do both of the tests. I would recommend doing both if you're able to. You can get money for that if you are eligible, so you don't necessarily need to worry too much about the money side of things, but it does mean that you've got a broader choice of institutions to go at. There's just a little summary there of Bmat in case some of you aren't as familiar with Bmat as UCAT. The distinctive things about it really are the opportunity to write an essay and to demonstrate the knowledge that you already have at level 2. I wanted to spend a couple of minutes about choosing university. I'm sure this has already been covered by other people, but it's so, so important to think about where you're going to spend the next 3 to 5 or even longer years of your life. So you need to think about the location. Do you want somewhere really big? Do you want something where everything's all on campus? Do you want the teaching hospital right next door? Or do you want somewhere that's a little bit more out of the way, maybe not so hustling and bustling? I mean, to give you an idea, Leeds has over 35,000 students. That's just at the University of Leeds. Then we've got Leeds Beckett down the road. Then we've got the Arts University. We've got Leeds Trinity University. So Leeds is an enormous student town. For some people, that's absolutely fantastic, but for other people, that's a bit daunting. So how give it the geographic location and how it's sort of laid out as some real thought. Style of teaching as well. Obviously, for medicine, you've got PBL, although that's less common now than integrated. Leeds is an integrated course. And then you've got the sort of more traditional ones, places like Cambridge. Where are the placement options? I mentioned placement for radiography is in Yorkshire and Humber. Audiology is also in Yorkshire, but for some audiology courses, you have to travel up to Yorkshire to do your placement. So again, you want to look at where your placements are actually going to be. I've just realised I've forgotten to ask you my other questions. So bear with me. I'm going to ask you at the end. We'll whiz through all of these. So what are we looking for at Leeds? We're looking for the required GCSE grades, A-level subjects and predicted grades, required work experience. Some places still ask for 5 days or 10 days, etc. And you need to make sure you can tick those boxes. Leeds doesn't ask for any minimal requirements on work experience. Required skills and attributes, again, all of these courses are subject to their professional regulatory bodies. So they will be telling the universities what they expect a student nurse or a student doctor to have in their course so that they can actually register and be professional. In your personal statements, those are just some of the things that we suggest that you think about. So your insight and motivation, so that's why do I want to do this course? What am I really thinking? Life experience and social awareness. What can I bring to the course? What have I done? How does it relate? What did I learn from it? How did I develop? Anything that you've done where you can demonstrate responsibility is always a good thing. And your interests and achievements. So I'm not going to go on at length about this because I think you guys have already been to some excellent presentations on interviews and things. But at Leeds, we do the MMIs for medicine and dentistry and the healthcare sciences. So that's audiology and cardiac physiology. We usually do 8 stations. It varies slightly from course to course, and the whole thing lasts about an hour. And fundamentally, all MMIs are looking at communication skills. They're also looking at your non-academic attributes. They are looking at how you present yourself sort of professionally. They'll also potentially give you a chance to talk about your personal statement. So a knowledge of current affairs, practicing those sort of situational judgment tests, thinking about ethics particularly, all good things to be doing. For nursing and midwifery, Leeds still doing selection events or group interviews. So that's typically half a day where you do a numeracy test and then group discussions. Again, communication skills are key here. There's no point in sitting there in a group session not saying anything, and equally, you don't want to be the person that's doing all the talking. So it's sort of putting your best self forward so that they have something to assess you on. Still do individual panel interviews for diagnostic and radiography and social work. So if anyone's ever had a job interview, they're a little bit more like that. You can see the blurb there. That's actually been taken from the COVID pages on the University of Leeds website, the medical school, sorry. So if you want to read that, I won't read it out again, but please do ask any questions at the end. My thing that I cannot stress enough really is just do as much research as you possibly can. Volunteer and speak to professionals if you can, and as well, events like today are an absolutely brilliant opportunity to do just that. Anything that can help you improve your interpersonal skills is of value, but it's really important not just to do these things but to actually keep a log, because if you haven't already started your personal statement, you're going to have to try and remember everything that you've done. So you want to know where you did it, when you did it, what you did, but more than that, what did you like? What did you find challenging? How did it develop you as a person, and what did you learn from it? Start on your statement as early as you possibly can. Redraft it many, many times and ask other people to read it. I did an event a few weeks ago and a couple of really good suggestions. If you've got contact still with your English teachers, then ask them to read it for you, because they're quite good at spotting small grammatical sort of errors. It is, after all, a formal piece of writing. It's 4,000 characters, or approximately 47 lines of A4. So it's good to get it started earlier the better, really. And just a couple of top tips about interviews, really. Just arrive early, get there with time to spare, make sure you know where you're going, make sure you feel comfortable. Dress comfortably. Smart casual is absolutely fine. Nobody expects you to turn up in a suit. But above all, ask lots and lots of questions. Interviews are as much about you finding out if this place is for you as it is the other way around. Some key dates for you already. So soon the UCAT testing is going to be open, and that actually finishes on the 1st of October. Bmat registration opens on the 1st of September, but there's only one sitting this year, and that's in November. So the 4th of November is the Bmat test. As you're fully aware, the deadline is 15th of October for medicine, dentistry and veterinary sciences, but for nursing, the allied health professions, it's 15th of January. We will also be having a virtual open day in September, October, dates to be confirmed, as will many, many other institutions. So as I said earlier, and apologies for not making this as interactive as I'd liked, it's because I'm not trying to look at the camera and look at the slides rather than reading my script, which has got my questions on. Very competitive courses, at least 9 or 10 candidates per place. And that actually goes up to more like 15 or 16 for midwifery. So to give you some kind of indication of just how competitive courses these are. There are health requirements for these professions. You have to meet the statutory and professional requirements. It's vitally important to think about that 5th choice. I can't stress that enough. So if you haven't thought about that 5th choice, then go away and do lots of reading and find out what you want to put down, because with the best will in the world, not everybody can get into medicine. Universities are well aware of the difficulties faced by students who've had work placements cancelled. They can't do the things that they were doing. So just by being here, you're already one step ahead of the curve. There are a couple that you may already be aware of work experience things online. The Royal College of GPs, Observed GPs, and Brighton and Sussex Medical School virtual work experience. It's a good place to start if you haven't managed to secure anything just yet. So that's enough of me rambling. There's a few contact things at the bottom there. healthsciences.leeds.ac.uk. You can find our email if you want to ask us anything. We've also got our Twitter handle there. So I can see you've got some questions. I'll just stop sharing this now. Phew. Right, I don't know about the entry criteria for graduates. It'll be at least a 2-1 for graduate training, sorry, for the graduate routes into medicine. We do take on transfers from year 1 medical sciences. No, we don't. I said we do. We did this year. We took on, I think, our last cohort. You need to apply through UCAS now if you do clinical sciences at Bradford. We used to have an arrangement that is coming to an end, and the gateway to medicine has taken over. Yeah, that's a brilliant question. It is. I don't know for exactly how to answer this, except to say that anything that you can do, whether that's volunteering, there are still voluntary organisations out there looking for volunteers to help with people who are self-isolating, for example. Anything like that that shows that you are helping, you're caring, you're dealing with people from diverse backgrounds, you're dealing with the public. It's those communication skills and sort of transferable skills that are actually vitally important for medicine or any health course. As for shadowing professionals, that will depend, especially with COVID-19, because obviously with their social distancing and the requirement to have PPE, etc., I imagine that the last thing they need right now is to have students sort of hovering around, shadowing them. So the best thing you can do is really just talk to people, find out what's going on online. So there'll be events similar to today, but there have been events. I've seen a couple. There might be advertised through local colleges where a local GP or someone will come and talk to the students for half an hour. So it's about being a little bit creative, thinking laterally, and just doing as much as you possibly can and talking about what you've got out of those experiences. Nobody expects you to have like 3 weeks work experience in a hospital. I mean, it's hard enough to get even when there isn't a pandemic, but you don't need to worry too much. The universities are well aware of the limitations that everyone has right now. GCSEs, really, the minimum requirement for GCSEs for the medicine course, and very similar for the dentistry, is it's 6 GCSEs at, well, we say 5, but if I'm honest, everyone is going to have higher than you if that's what you've got, because it's so competitive. And we ask for 3 A's at A level. A lot of the students who get the 3 A's at A level but get the 7s, 8s and 9s at GCSE. They're scored, it's approximately, I believe, 23% of the scoring is on your GCSEs, which is quite high. So the higher grades you have, the better. That does not mean that you are rejected on the basis of not having 7s, 8s and 9s. That's not how it works, because it's more like a gathered pool, a wait and see. But it is true that at Leeds, GCSE grades are quite highly weighted. Sorry, heavily weighted. You're welcome. I'm not quite sure I understand your question, Laura. Laura's asked, when is the elective for medicine, and do Leeds offer student selected components? I'm not quite sure I understand that question. We do have optional modules, but I think really to see the different modules and the electives, you would have to look on our website. Unfortunately, I can't remember all of the different vagaries of the different courses, but look on the website. That will give you much more detail on what the options are in what years and how much is compulsory and how much you get to choose, if that's what you mean by that question. I'm just checking through to see if I've got any key questions I wanted to ask you. 1 or 2 aren't as relevant, since I think most of you want to study medicine and dentistry. Yes, it is near the end. I haven't got any more slides. I'll just hang around for a couple more minutes if anyone's got any more questions. But thank you very much for coming today.
Hi everyone, just popping back in. I am conscious that is near the end of the session for this hour, so I wanted to ask if you had any final remarks, Teresa, at all?
Not really. I just want to wish everybody the very best of luck, and please don't worry about the difficulties that we are experiencing this year. Everyone is in a very similar position, not the same, but very similar. Everyone's got the same restrictions, so you don't need to worry about not getting work experience. It's not going to be the biggest thing that holds you back this year. As long as you can write about what you have done in a meaningful way, in a reflective way, and you can be honest about what you've learned and what you've gained and how you've developed, and those are the key things they're looking for.
And thank you so very much for today's session.